When you want to improve your appearance, what do? Well, you might take on an exercise program and lose a few pounds, get yourself a new outfit, or maybe even change your hair. But when's the last time you gave your smile a makeover? That's right, your smile. After all, that's something you wear every single day. And a great smile, or the lack of one, can have a huge effect, not only on how you look, but on how you feel. Hi, I'm Janice Marie for Close Up on America's Business, and we're here in Red Bank, New Jersey at the office of Dr. Dana Fallon and the Cosmetic Studio for Cosmetic Dentistry. Dr. Fallon is a cosmetic dentist, and he says that he can have your pearly whites looking pearlier and whiter and better than they ever have before in just 1 or 2 visits. Well, we thought that sounded pretty good, so we decided to pay him a visit to find out more.
I'm a cosmetic dentist, and basically, we have the opportunity to change somebody's life. By doing porcelain veneers, sometimes it's bleaching, we can really enhance someone's appearance and, in fact, change their lives.
So talk a little bit more about why specifically someone might come to you.
Sometimes it's a little enhancement that they're looking for, and sometimes it's a real personality issue. Sometimes a patient is just very afraid to smile. There are studies that show the first thing we notice about people is their smile, and in many cases it can really hold someone back.
You mean then that they would be embarrassed about the shape or the color or the crowding of their teeth?
Sometimes it's wear, sometimes it's color. Sometimes you get these real aggressive guys that grind their teeth. They show so much stress in their teeth, and over time the teeth wear down. And as that happens, it gives you the appearance of looking older.
All right, I'm one of those people that hates going to the dentist. I don't know anybody that loves going to the dentist because I don't like all that pain. Is this a painful procedure?
People always want to know, well, how much drilling are you doing and what's involved? And the answer is, we do what we have to do to create the end result. And sometimes it's a little drilling, sometimes it's a lot. I have to be able to look at that person's smile and see the end result before we start.
Talk to us about veneers. How does that process work?
Well, the veneer is like a fake fingernail or a press-on nail. And you have the ability to change the shape, the position, the contour, and the color by using the veneer. We have to look at the person's smile relative to their whole face. We have to look at how their smile fits in. We have to pick teeth and color that are appropriate for that patient. The veneer will allow us to do that.
Why might someone choose to get veneers?
Veneers offer us a great degree of flexibility and more control over the end result. Now, in some cases, if the patient's teeth are in great shape, if the basic teeth are okay, they may just want to be lightened. Then we can do zoom whitening or something like that. But in a case where there's more going on in the patient's mouth, whether it be through decay or through wear or just attrition, then a veneer is really the way to go.
You also mentioned that you do teeth whitening, and that's a really popular process these days. We hear about that on the radio all the time. Tell us about that.
There are a lot of ways to go with whitening, and there anywhere from the strips at the supermarket, and in some cases those do work just fine. We offer zoom whitening, which can be done in 1 visit. It seems like everybody today wants to get things done immediately. They don't want to wait. So with zoom, it's a 1 visit procedure in about an hour, and the results have been remarkable.
And are the results permanent?
The results are lasting, but it does depend on the patient's habits. If they're a smoker, or they drink a lot of coffee or red wine, the results won't last quite as long, but we do expect them to last anywhere from a year to 2 years.
Now, the process you use is called Zoom, but I hear about other teeth whitening methods out there. How is Zoom any different or better than that?
The reason I like Zoom is because it does work quickly, and the results are, I think, the best results on the market.
Do you also do general dentistry, fillings and root canals and teeth cleaning and that sort of thing?
I don't do general dentistry as such. I'm not a jack of all trades. I do believe in my philosophy really is I believe in the best person for the job. So I don't do root canals, I don't do extractions. I do focus on on smile design, smile makeovers. But we do fillings, we do back teeth as well.
You're a cosmetic dentist. How is it that you came to focus on that particular field?
Dentistry can be a little boring, to be honest with you. And I was real unhappy with my job when I first came out of dental school. It came to a point in my life where I had to either change careers or change the direction I was heading in dentistry. So I decided that cosmetic dentistry really suited my personality.
What technologies and advancements have been made in the field of cosmetic dentistry in the last several years?
The porcelains, the materials we have available, the bonding techniques, the ability to bond in ways that we couldn't before, it gives us possibilities that that didn't exist, just 5 years ago.
Aside from whiter teeth or straighter teeth or prettier teeth, what are you really giving your patients?
I take before and after slides of all my patients, and I used to always look at the teeth as part of the after. And then I started noticing a change in the patient's eyes. So the first thing I see now is a real difference in their eyes. And that really shows me that this has made an impact on their lives.
How long does this whole process take? Does someone have to come back for several visits?
It can be done in 2 visits. Many people have had caps or crowns done, and they assume, well, if it took 1 hour to do 1 tooth, well, it'll take 10 hours to do 10 teeth. And it's really not like that. We have a system, and we do it the same way every single time. And it's basically knowing how to do it effectively.
I'm sure there are a lot of cosmetic dentists out there, so what sets you apart from others?
The real thing that sets us apart is the training. You can't just one day decide to be a cosmetic dentist without actually paying your dues. There are a lot of hands-on courses throughout the country, and the dentist needs to go ahead and take those courses. It's not like sitting in a lecture. You have to go out and really learn how to do it properly.
Do you feel your art background comes into play for you?
Absolutely. It's not just about teeth. You really have to make that smile fit the person's face and fit their personality. You have to have a sense of style. You have to be able to look at that person and know what teeth should look like on that face.
Well, I'm looking around here at your office, and it's absolutely gorgeous. It actually feels a lot like a spa. Is that part of the design as well?
We wanted to create a relaxing atmosphere that didn't look like your dad's or mom's dental office. We didn't want the smells, the sounds, the feel of that old office. We wanted something that was open and didn't really look like a dental office.
Describe your office to us.
It's open, it's got a warm feel. I think it's a combination of high-tech with a warm, almost homey feel.
And I noticed that your patients have headsets and they have TVs to watch and blankets.
We want the patient to be as comfortable as possible. When they're comfortable, I'm comfortable. When the patient's stressed, we sort of feel that stress as well.
What do you love about what you do?
I love the ability to share my passion. I love the ability to really change someone's life. Patients are so sincere about it. They're so moved by it, and how can you not love what you do?
Do most of your patients come to you already knowing what they want, or do they leave it up to you to tell them what they're going to need?
Some patients know exactly what they want. They want Halle Berry's smile, or they want some model smile, and they'll come in with a picture. And that works just fine. We'll send that along to our ceramist, and Brad will duplicate that smile. Most of our patients don't really know what they want, and they kind of leave it up to me. So it's my job, again, to fit the smile with the patient.
A final word. Why the Studio for Cosmetic Dentistry?
We're the best. I feel like we know what we want. We know how to deliver, I think, the best quality, the highest quality clinical care possible.
There's a wonderful song that says, when you're smiling, the whole world smiles with you. So start smiling some more. And if you need some help with that, to make that smile look that much better, give Dr. Dana Fallon a call. We're sure you'll be glad you did. I'm Janice Marie for Close Up on America's Business in New Jersey.